we're this is in our longevity, health, lifespan, like all these great things that we can talk about. So lots of great things. But welcome to the show, Matt.
Thanks.
Just like
Thanks for
throwing it
having
out
me.
there. Your product was featured on the Kardashians, so that's kind of wild, if I'm remembering correctly. So what's the story behind that?
Yeah, so it's funny. I gave a talk last week at a place in Nantucket, and they introduced me and mentioned that, and I was like, "This is not what I ever expected or wanted to be on my CV." That I was on an episode of the Kardashians, but yes, it did happen. So they actually had just taken some of our tests, and we didn't know at first. They took it under an alias, but then they reached out and wanted to go over it on the show, and so they did a whole episode kind of on their longevity and their pace of aging, and so we just went over the results, and it was fun. They were really into it. They got really excited about it, so it was fun interacting with them. They were very nice.
So the when you like what was the I guess from like the business side of my head is just curious about the interface. So you have these anonymous people using your product, and then you have someone saying, "Hey, we're the Kardashians." So first, how do you know that's not just someone pulling your leg? Like, how do you know these people are actually like the real people?
Yeah, it's not Kim that calls. So
Hmm.
that's what you want. So yeah, it was just a producer from their show. And so they've got a nice little on the letterhead, and you have a call with them and stuff. And so and we've had a lot of celebrities or others take the test and things. And so it wouldn't be out of the question or out of the ordinary for that to happen. And so yeah, it was a pretty straightforward process.
Did you learn anything from that experience that you've applied to other areas, or just
Um, So I don't know how many people could ever say they learned something from the Kardashians per se, like watching the episodes or being involved with that. But I don't know if I can give you any real takeaways from it. And it's funny, we went here like I'm a physician and scientist about training. I've like published a lot of things, and so I always get thrown off when we start talking about the Kardashians or things. So, but it was a fun experience working with them. They were kind, and it was obviously good for the business because you get some attention and things. So it was good overall. I was, to be honest, I was a little nervous about it at first because we're a deep science company. In the last 2 years, we've published over 31 studies with Harvard and Mayo Clinic and Duke and Yale and the biggest institutions in the world. We've got over 100,000 patients in our data set and have done really good science. And I got a little nervous just about what it looks like to be on kind of pop culture on that radar. And you
Mhm.
worry about the message that comes out. You worry about how it's portrayed on the show because it's not like you get to do a really deep dive on the science or anything like that. And sure enough, there were a couple things that when I explained the results and we spent it's a 45-minute call, they cut it into 3 or 4 minutes. And so cutting some things out, you lose some context, but it's fine. I didn't expect it to be like a deep dive on the science. So it was okay.
Yeah, the I think the interesting thing for the reason why I wanted to start there is that it is kind of the meetings. It's like you take the deep tech and you're translating it into something that can be used for the general public. And I think in many ways the Kardashians or any of these like influencer type people are very like they're like a amalgam of what the general public is interested in. So if they can interface with that, it's kind of like a little test bed for the rest of people being interested in it. And then it's also like kind of like a little bit of a vote of confidence. So it's like you get two wins there, and that you're a scientist, you're a doctor, you guys have the research publications behind it, and then it's also like, oh wow, someone I know knows that. I guess the Kardashians wouldn't be doing this if it was too crazy. But I guess maybe not. Maybe they would do if it was crazy. I don't know. I don't watch it, but I know that like people get pretty crazy on there. So especially from a as a side like physician, the experience of interacting with people like that, that's very interesting because they're people that get stuck in the lab or in academia, and their skills kind of atrophy in terms of like how to talk to the general public. So
Yeah.
taking something like really complex and downloading it for the Kardashians for them to download it to their audience, like that seems like a very like useful endeavor, like in terms
You're
of
to-
just like yeah.
You're totally right. And while I may be more comfortable like speaking at an academic setting and giving a scientific presentation where you have time to go deep on it, in the end, if you want your work to get out there, if you want it to actually be used by people and people to get the benefit, you've got to be able to translate it for the general public as well. So it's a really good exercise, and it's good to train that muscle to be able to talk about it in a simple way that anyone can understand.
Yeah. And so when you guys so they contacted you, you went on the Kardashian show, then there was a outpouring of some sort from that, where if you use what people said to you afterwards, like people like pinging you, say, "Hey, I want to use your product," what have you. Was there something that you could have clarified better on the show, or that you wish you could have gone deeper in so that people coming in? Because there's like in sales, right? If you have like a good email funnel or like a good funnel in general, most of the questions are answered by the end. And so whenever there's questions at the end that people don't have, that's kind of interesting to like relook at and then analyze to see like, oh, how could I have said this better in this email, or how I could have written the website better in this way.
Yeah, I think the biggest thing, the biggest clarifying thing, which clearly we didn't have time to go into or talk about, is people just hear biologic age tests. And the issue is right now there are just so many like calculators or different tests that are out there. And without having time to go into the science, you kind of get lumped into a lot of those. And a lot of people will talk about how like these tests aren't useful or aren't any good. They aren't precise enough, things like that. And the problem is they're correct for like 90% of the tests out there. There's only a few clocks that are really good. So when you get out into the public and you're in a space where there is a lot of noise, sometimes you can be conflated with the noisy stuff that is just marketing. So I think we need to figure out how to do a better job of separating ourselves and the science-backed products we have versus what's out there.
Yeah. Is the That makes a lot of sense, especially as, I mean, if you're getting in these areas, I could see people just seeing that and thinking, "Oh, okay, I'm gonna me too that product," because clearly it's sufficient enough. That's kind of the danger of being so smart and working on something so hard for so long. It's like the 4 minute mile, I think, right? For the longest time, no one thought a 4 minute mile could be done. Then the person did the 4 minute mile, and then the second person to do the 4 minute mile was like the next year. The third, fourth, fifth, there's like 20 of them after that. So like you kind of like prove and like pave the way with your sweat, with your hard work, um, which is kind of like the trade off for those situations. So then when you are in the top, which I think True Diagnostics is really like leading when it comes to these things. Um, how do you differentiate yourself? How do you get above the noise? Is it like certifications? Do you like get more like Kardashian thumbs of approval? Like how do you do that?
Yeah, I think you just got to publish, publish, publish. And
Mm,
the difficult thing is like once we're out there and people see like, oh, there are some good clocks, we can look at this biologic age, we can get good useful information from it. And then there's publicity like from the Kardashians, then these kind of calculators and clocks just start popping up everywhere, and consumers don't really know the difference. And so we probably should do better about telling the story in general. But for us, it's just leaning into the science more, continuing to work with our collaborators, and just hoping that eventually that kind of rises above the noise.
mhm. And you mentioned that you weren't able to go into detail about the differentiation between you guys and the other ones. So I'd love to get into that now, just for anyone listening who doesn't know. Um, like, how would you describe what you guys are doing? And for anyone who wants like a even deeper dive, we had Varun on like a couple years ago, and we talked about like the from a data science point of view how you develop a product like this. But just for like anyone else out there, if you like this interview, like check that one out too. But so, what is like the special sauce about what you guys have developed?
Sure. So I'm a physician, and I before I joined True Diagnostic, I founded a company called Wild Health, which was a precision medicine company. And like every patient we would see, we sequence their DNA, do a ton of blood testing, pull in wearable data, phenotypic data, microbiome data, and then we create a platform to take those millions of data points and make precision medicine recommendations. Well, so biologic age tests and epigenetics are something that we would test as well. And for the longest time, I mean, these have been out for a while. And to be honest, I didn't care about them. For one, a lot of them just they weren't good enough. The science wasn't there. But even the ones that I thought, okay, this is a good clock. It tells you your biologic age. For me, just getting that number and that biologic age just didn't mean much. So if I'm seeing a patient and they're 40, well, and chronologically 40, and it comes back if they're biologically 36 or 44, I'm still just going to try to optimize them either way.
Mm-hmm.
So I didn't have a lot of utility for them. And a lot of the early clocks, the science was really poor. Like the first generation clocks, you could send the same test the same day and get a difference. On average, it was 4 years difference. So that's not useful to
Mm-hmm.
me as a clinician. And that's how they've been for a while. Where that changed is about a year to year and a half ago, and this was before I actually was a part of True Diagnostic. Duke came out with a test, which I think is by far the best and the one that I used clinically even before coming to True Diagnostic, and it's called the PACE test. And the reason I like the PACE test is it was developed from this really interesting cohort out of New Zealand. It's the Dunedin Pace cohort where they followed for decades. And this test doesn't actually give you a biologic age, but it gives you your pace of aging. Now, that's very interesting to me for a couple reasons. Number one, if I get someone's biologic age back, most of the effect of that has been the rest of their earlier life. If they did shift work, if they had a really difficult life in their 20s, it's going to have a really negative effect. And you may be doing everything perfect right now, but your biologic age may not be great. I can't do anything about the past, but your pace of aging right now tells me a lot about how you're doing right now with your rate of aging. What I like about the pace also is it's very sensitive to intervention. So it's been shown to change. Like, for example, if you get pregnant, that's a physiologic stress, your pace of aging goes up by 20%. If you get in a car accident, get COVID, have hip surgery, your pace of aging goes up. But then when you recover, it comes back down. So what this allows me to do as a clinician is to do these N of 1 experiments with people. If someone wants to change their diet. So Stanford did this twin study looking at omnivore and vegan diets, and they used the PACE test to measure rate of aging, and it changed. In 8 weeks, they could find changes in pace of aging. So someone wants to dial in, they want to try carnivore, or they want to be vegan, or they want to do a keto diet. Let's measure their pace of aging before or after. If someone comes to me and says they want to do IV stem cells in Panama and spend $40,000, well, if you're going to spend that much, let's have some sort of measurement. There's not really a good measurement for that. So let's look at your pace of aging before and after, because it's a really good integrator of everything else. And for someone like me who's always trying the newest things, whether it's if I'm going to do rapamycin or try a new senolytic or do something like that, I want a measurement of, is it working? And the pace gives you that kind of real-time measurement of how it's affecting your pace of aging, so you can optimize and stack the interventions that work for you. So that's how I used it clinically. And that's still, when people want to know about tests, we have licenses, exclusive licenses to like a ton of clocks, dozens of clocks. But it's really that pace is when I really talk to people, like that's the one. Because the last thing I'll say about it is, I mentioned earlier, like the early clocks, they would be different by 4 years, and that's just not usable. If I do a test and a year later do a test and you've gone backwards 3 years, is that just standard error, or did we do something? So the PACE has really tight ICC, or intra-class correlation, and it only varies by a few percent ever, which is better or as good as pretty much other standard labs. Like lipids, going to be 5% off or so. All tests are off a little bit, just from normal variation. So it's really tight. It's really precise. It gives me something actionable, and I can use it to follow these crazy longevity interventions everybody wants to try.
If the old ones that are not as good, if they were like 4 years, off, plus or minus, what have you, and the pace is really accurate, you said 1%, but what is that in like a time span in terms of accuracy? Like what's their plus or minus?
So for 4 years, it was about 4.5 years, like one of the kind of the first kind of Horvath clocks. And so if you're thinking like biologic age on average around 40, so it's about 10 to 15% variance usually is what you would see with those.
Oh, okay,
And
wow.
that's just too much. That's too much to be really useful.
Yeah, so 1% would be like a month, like I guess. If 4 years is 15 to 10%, then like less than 1% is like not that big of a difference. Like you'd be able to track something, an intervention over like 6 months pretty clearly.
For sure. And we see that frequently. So with the pace of aging, so you get a score of like 0.6 to 1.4. So 1.0 means you're aging at normal expected rate. If you're at 0.9, you're aging 10% slower. So over 10 years, you're only going to age 9 years. So, and we see that with interventions frequently. Someone will go from a 1 to a 0.9 to 10% difference. And we know that's real because there's only usually a couple percent variation that is just kind of standard lab issues. So we know that's a real result there.
What's the value of knowing your rate of aging? Is it like the probabilistic of like if I'm aging at a certain rate, then I know I'm going to be like roughly the age of like 45, so then I need to be worried about, colon cancer or something like that. Is that the value of it? Like what is the value of knowing your
Yeah,
rate of aging and where you are in the aging,
sure.
lifespan?
So age is the number one risk factor for every chronic disease. Like there's some really interesting like bar graphs I could show you on that, where like the risk from smoking and alcohol, being sedentary, obesity, all these things, they're dwarfed by aging. Like older is the thing that makes us the sickest and leads to the highest likelihood of death. So the slower you're aging, the lower you're decreasing your odds of every disease basically and death. So that's it. Like if we want to live longer and healthier, the number one measurement would be your biologic age for determining that.
Hmm. Okay. So to slow it down, because the way I think about it, it's a similar thing, right? That like it's like a probability. Your probability of any type of illness goes up as you age. So like
Mhm.
a 20-year-old can theoretically have illnesses like of a 50-year-old, but the probability of it is like so low, people just you don't test for it, you don't even look for it because it's very, very unlikely.
Yeah, that's
But
right. Everything is stats and probability, and yeah, the slower you're aging, the higher likelihood that you're not going to get whatever disease it is.
mhm. It is interesting. So as a physician, I am curious. So there is like a higher rate of colon cancer going on at earlier years, and there's a lot of other things that are going on that seem to be coming earlier. Like I think some people are saying it's like microplastics or whatever, but do you have any ideas or any thoughts? And not science advice for anything that we're talking about today. Just as like, I forgot to add that as an asterisk in the beginning. But I'm just curious, like your thoughts. Like, what do you think's leading to that?
Yes. So in general, modern medicine has been really good at solving acute issues like infection, trauma, car accidents, things like that, surgery. It's great, but medicine has not done a good job at these chronic diseases, which I would classify cancer as one of those too. I think it has to do with everything. It's our lifestyle. It's our diet. It's our sedentary lifestyle. It's the chemicals and things that we're exposed to. All of those things just seem to be going up more and more. I think that's it. Like I don't, yeah, people talk about and worry about microplastics a lot. Is it good to have a ton of plastic in your body? Microplastics? Probably not. But there's not really been great studies of just how bad it is, or is that a cause of anything? That's going to be hard to prove. But I think it's just a combination of things in our environment that we're exposed to now and the way that we're living.
I think the well, our parents' generation, they had lead and everything. They loved the taste of it and paint and you name it. It's a facetious frame of listening. I don't think they actually enjoyed it, but they didn't know that it was bad. Where now we have like the PFAS, we have plastics and some other stuff going on. But if you could like wave a wand and like destroy something from the environment that you think is like a negative cause for something that's going on, is there something that you think outside of like what people can control, they think it impacts people's lives hugely?
Yeah, yeah, that's a great question. If I could wave a wand and take anything away, I think there's the things that we know about, like
Mhm.
glyphosates, for example, though we know they're carcinogenic, obviously cigarette smokes and just pollution in general that we know about. I think there's also just an incredible amount that we don't know about. We're constantly like we'll realize, for example, that BPAs are bad, and so you start taking out of plastics, but they start using other chemicals to be able to get the same results. So I think it's really like clearly removing kind of just pollution from the air in general and glyphosates would be tremendous. And I think we're doing a good job of those. But my concern is that like we keep coming up with substitutes that no one knows are bad yet because they haven't studied them, but they just kind of keep keep popping up.
Mhm. Yeah, that's I think I was reading that med devices in a lot of ways that they usually piggyback a lot of their innovation on previous med devices, and so they're able to like kind of short circuit and speed run the FDA if they're able to show like, well, this was used successfully in an FDA approved application like 5 years ago, so they kind of get in that way. But then that one was also approved from a previous one, so like people aren't really like vetting the individual things as much as they used to. Like we're kind of like
Yeah.
building like a house of cards a little bit.
Yeah, it's the FDA process in general. Like to get something FDA approved, you can have what's called a de novo application or a 510(k). So a 510(k) is to say there's a predicate, something that was similar but in the past. It's much easier. And so that's what you're talking about. Because that system is in place, it's just a lot easier to get approval if you have that predicate. And so it leads to probably a lot of the same mistakes being made.
Yeah. Well, I was reading that that like there's a hip replacement that the material, if it's in a hip like in a joint that moves around a lot, like it wasn't originally tested for something that has like the type of grinding mechanism or something. And
Hmm.
so if it's a hip and it has that grinding stuff, like some of it like grinds off of some sort and it goes to the brain and kind of like causes dementia or something. I was reading a
Wow,
publication, I think it was like 3 or 4 years old. I wish I could cite it. But there's like they've like kind of drawn a link there.
that's
Actually,
interesting.
are you into the brain at all? Are you following like the Alzheimer's stuff or anything like that?
For sure. Yeah. It was a big part of why we started Wild Health, actually, was related to Alzheimer's, and my grandmother and my mother has ApoE4 gene. And yeah, for
Mm.
sure.
What do you think about the idea that Alzheimer's as a like type 3 diabetes
Yeah, for
or immune
sure. So,
system?
um, metabolic health is just such a big driver of all chronic disease. So it is of heart disease and cancer as well. And so, when you are metabolically unwell, when you have insulin resistance, it 100% increases your risk factor for Alzheimer's. It's when we started Wild Health, one of the first patients we saw was my grandmother, and then after that, my mother, where she would have this ApoE4 gene. And when we sequenced her DNA, she sure enough had this ApoE4 gene, and made her 2 to 3 times more likely to get the disease, to get dementia. And one of the first things we focused on was her insulin resistance and her hemoglobin A1C. And in fixing that, I truly believe we probably really delayed added probably 10 years to her life, because she in 3 months, she lost 40 pounds, reversed her insulin resistance, and said she felt 20 years younger. But focusing on that metabolic health was critically important to delay and hopefully prevent her dementia.
Mhm. So if the average person is more sedentary nowadays, I mean, right now we're both sitting. I think you're sitting as well. Uh, what can we do to be healthy nowadays? Is if we're concerned about our brain health, I saw a neurologist, and he said if you want to do anything good with your brain, start with your heart, like exercise and stuff like that. That a lot of brain problems are really heart problems. If you have heart disease, like a lot of your actually, I was like the brain moves around in your head by like 3 millimeters over a course of a day, which is kind of crazy. Just like
Mhm.
wiggling around in there.
Yeah,
Yeah. So what can we do? Yeah.
yeah, the same things that are good for your heart are good for your brain. Like it is. So there's a great Dale Bredesen wrote a great book called The End of Alzheimer's, and he talks about kind of I think 36 holes in the roof, and he's got it's a really good lifestyle approach to the disease in general. But it's the main things we know. But exercise, 100%, like intense exercise, increases BDNF, which is like miracle grow for your brain, and is very protective. And absolutely, like, sure, you can certainly avoid sugar. We talked about Alzheimer's is kind of like type 3 diabetes. So you certainly
Hmm.
should avoid processed foods and sugars. But I think if you had to choose one thing, it would be the exercise more than anything else. Intense exercise, and almost really kind of as much as you can. I mean, I am a sucker for that. I mean, I work out usually between 1 and 2 hours a day. One thing I like it makes me feel better, but I really believe that that's like the one activity that's going to have the biggest impact on my health span, and delaying things like dementia.
How do you know when you're having an intense exercise or if you're just out of shape? Like, at
Yeah,
a certain point you kind of plateau and it's like, oh, it's easy.
it's all relative. So it's all heart
Hmm.
rate based. So for me, it's
Okay.
zones, and it's heart rate based. And I'm always measuring the heart rate when I'm doing workouts. You have kind of your base, which is zone 2, where you want to do most of it. That's kind of like 60 to 70%, just kind of use really rough numbers of your maximum heart rate, which would be 220 minus your age, or you can actually do a test and see. And then I want to spend certain amounts of times in zone 3 and 4, and like a tiny amount in zone 5. And now for me, if I'm in pretty good shape, and then you got someone else who's not in good shape, well, they're not going to have to actually do as much to get their heart rate up. So it really is individualized and personalized and relative as to what is intense exercise. It's more about your heart rate zone compared to your maximum.
Mhm. So if you're a fit person, and my objective is to be fit as well, but what do you do during the different zones to hit it then?
Sure. So zone 2 is a zone where you should be able to have a conversation. Like right now, if I was in zone 2, you could tell you don't want to have a conversation, but you can, and people would be able to understand it just fine. Once you get to zone 3, you're not having a conversation anymore. So this is when, if someone doesn't want to follow kind of their heart rate zones, just want to measure it with an Apple Watch or a chest strap or something like that. This is how I kind of talk about it. That zone 2, where you can talk, you could do it all day, but you don't want to. So how I do it is a couple different ways. For me, the best 2 ways is I row, and I love to watch like educational documentaries and stuff. And so I can row, I'll be on a row machine for an hour and in zone 2, and I got a good workout. Where I do a lot of rucking. So I will fill a backpack with about 70 pounds. I mean, it's just different for different people, and how big you are. But I put weight in that. And what I love about that is you're getting the cardiovascular benefit, similar to maybe like if you were going for a slow run, but you're walking. It's not as hard on your joints and my back. Is now that I'm an old man, I got to think about things like that. And you get a little bit of a strength workout. So I'm into getting zone 2, but doing a strength workout because I'm carrying a lot of weight on my back as well. So I'm getting kind of a whole body strength workout in zone 2 at the same time. So those are kind of my 2 favorite ways to get in a lot of zone 2.
What's the backpack you use?
So there's a company called GoRuck that I've had a
Mm,
ton of them. I think the number one thing to do is just make sure they have a really good waist strap. It's really comfortable, because you don't want that weight all riding on your shoulders. You want to be able to kind of distribute it evenly. But the company that I found, and unfortunately they're expensive, but they're the best, and they have like lifetime warranties or something. It's just got to Go Ruck is
Mm.
the best one that I found.
Do you do any like yoga or stretch or anything like? I assume you do some level of stretching when before and after you exercise, but do anything for like mobility?
Yeah, I do. I am so impatient and ADHD that I'm not really a yoga and stretching person. But what I do is I'm always trying to stack everything. So what I mean by that is I'm doing the zone 2 rucking while I'm taking like business call, like while I'm calling and talking to the team and stuff like that. And like I said, when I'm rowing and watching educational documentaries. So all throughout the day, when I'm on a call or in other things, I'm in the floor. So we talk about us sitting right now. This is rare for me. If I'm not don't
Mm.
need to be focusing on the computer, if I'm doing something where I don't need to be sitting, I'm in the floor doing stretches. And 10 years ago, it didn't matter. I was fine. But now that I'm in my mid 40s, like it makes an incredible difference. And so I try to stack it. I don't have the patience to stretch or do yoga by itself, but I'm probably getting an hour to 60 to 90 minutes in every day, just doing
Mm.
it that way.
Have you seen the documentary called Oppie? I think it is Oppy.
No.
Oh, it'll make you cry about it. It's one of the Mars rovers, and it's like
Yeah.
just telling their story and like humanizing the rover in such a way, like telling its life, what it's done, and all these different things. And it's like it's educational, but it's also like kind of makes you cry for a robot, which is kind of fun to like humanize it in that way. But it leads into the question of like what documentaries have you watched recently they've recommended people?
Oh, good. Yeah, good question. So a not very uplifting one at all, but because I'm in the medical field, is I just watched it's about the Sackler family and the opioid
Oh, I hate them.
crisis. It was, man, it was painful to watch, but it was very well done. I am a big nerd when it comes to farming and permaculture. I live on a couple hundred acres in the woods and grow most of my food. We grow a ton of food and stuff. It's a really good documentary called the Littlest Farm, Little Big Farm, I think it was. It was just really cool and uplifting story, the opposite of the Sacklers. So I'd say those are kind of two good ones I've seen recently.
Yeah, I imagine it's probably really hard to be like a kid in the Sackler family and just like grow up with that
Yeah.
type of weight of your family. It's like I don't know the yeah. Usually on the show, and I'm like holding myself back because I hate the Sacklers. Like the generations of damage that they have done. Like it'll probably take over 100 years before it'll probably never really fix itself. Like we'll have to do like a lot of interventions to help out the people that really need the help.
Yeah,
Um,
what's great is the amount of people that died you can quantify, but what you can't quantify is like the ripple effects of those
yeah,
families and the people that loved those people that died. And it's just, it's a horrific thing in certain areas of the country.
yeah. There's a Hulu show called I think called Dope Sick, and it has the guy who played the
Yeah.
Batman and what's his name? I don't know. He's playing Beetlejuice. Anyone will know what I'm
Michael
talking about, but
Keaton.
it's Thank you so much, Michael Keane. He's a good Batman too, but he was in it, and they show that the human side of it, which is very. If no one knows what we're talking about, definitely highly recommend it. Um, I wish there was like something that we could do, like as a general thing. I would have like a little link at the bottom of my thing, like where we could donate to a nonprofit that like works on that type of stuff. But um, the nice thing about do you know of a? Yeah, I'll just throw it to you. Do you know of a nonprofit or anything working on this space?
So I think there are probably a lot. I guess what I was going to say though is, and this is just my personal belief about this problem, and um, I think most of and look, I started a precision medicine company. I work in deep science. I want to do like the cutting edge stuff, but I think most of our dis-ease that we have when it comes to a lot of our diseases and this issue with opioids and things comes from a place of disconnection. I think that is probably our number one issue we're facing right now. There's a great book by Johan Hari. Now I'm blanking on what it's called. Lost Connections. That's what it's called.
I'm just gonna Google it.
Um, and he makes a great argument for this. And when I'm asked to talk about longevity all the time, and everybody wants to talk about rapamycin and senolytics and like all the hottest stuff, which is fun. But it's the connection piece. There's a great Harvard did the best study I think that's ever been done on this 80-year study looking at longevity, health span, happiness. And what they found is the number one predictor. We know smoking is bad for you, alcohol, like all these things. It was your close personal relationships. Loneliness was more detrimental than smoking, and smoking takes 10 years off your life. And when I say connection too, I'm talking about connection, not just to other people, but connection to our bodies, like with our
Mm.
exercise being connected, connection to our food, knowing where they come from, not having like processed trash that has microplastics in it, connection to nature, connection to other, obviously, and then even potentially connection to a higher power, something bigger than you. If we really focus on that connection piece, I think that's why people get addicted to opioids. It's the disconnection piece, and I think that's the biggest role in kind of all of our disease and a lot of our problems we have.
Yeah. The have you done a move recently? I know you were at one job, your precision health startup, and now you're at True Diagnostics. I don't know if that required you to move or it was just in the same town.
No, it's in. So I am based. So True Diagnostic is based in the town where I am and where I founded the precision medicine company. So I've been in the same place for a while, same house in the woods.
Okay, I was gonna ask you if you did had to move or something like that, what were some of the things you did as you got into a new area to like get connected? But I think it's also interesting when people are in an area that they've been in for a really long time, like how do you continue to develop that connection? I don't know if that's
Yeah.
something you're comfortable talking about, like some of the things you do
Mhm.
to feel connected to your environment and to yourself and to the people around you.
For sure. And it's actually the same thing I said earlier when I talked about stacking. I mean, I'm a big fan of
Mm,
like doing multiple things at one time. So just to give you an example around connection and stacking, like frequently I'll start the day a lot of times with our team who will come up to my house. So we've got like a lot of trails and things. And so in the morning we'll get together. We'll go hiking or rucking. I'm carrying weight. And as we do it, we have like actually a lot of wild food too. So I'm foraging. So I'm like connecting to myself, my body, doing this exercise. I'm connecting to the team. I'm connecting to nature. I'm connecting to food because a lot of times we'll forage and then I'll cook something afterwards. And I have hundreds of logs inoculated with culinary mushrooms on the property. So we may go harvest some of those. But it's stacking that connection in nature with other people while I'm doing the exercise too. That's to me, that's how I stay connected is
mm.
figuring out ways to get others together doing those activities.
It seems like a very well integrated life. Like a lot, I think a lot of people they go to work and they talk to people at work and then they try to keep it bottled up. Then they come home and they kind of have their home life and then they bottle up that in certain areas as well. It sounds like yours is very integrated, which is a nice. I think that's like something that entrepreneurship offers in particular. I've been kind of running off a thesis that I think like the future, whether it's AI or whatever is coming down the road, I think a lot of entrepreneurship, even with entrepreneurship within a company, is how like people can kind of really not I don't know, like manifest is a weird word, but like align the world to be connected. Because I think in a lot of cases people are in roles where they're told what to do and they're not able to kind of align things in the right way. Because I'm sure you, as a leader of a company, would probably allow people, like not just allow, but encourage people, like show people how to have the integration, like you're inviting them out and doing stuff like that. But other people might not. So I think like some type of like entrepreneurship, self starter type situations are how people I think are going to adapt to the coming future, so that they can have this
Yeah.
type of stuff.
Yeah, I think as a leader, if you're trying to micromanage and tell people what to do and not give them any autonomy, it comes down to kind of trust and connection again. If you don't trust them to do that, then you probably shouldn't have them as an employee. And by trusting them and letting them get their work done and do it how they see fit, they're going to be happier and they're going to be more productive. You also mentioned kind of bottling up and separating home life and work and all those. To me, I've never fully. I hear people talk about work-life balance, and it always kind of bothers me a little bit because it's like you're saying your work isn't part of your life. I mean, you're spending 8 hours a day doing that. That's kind of sad to me. So I agree with you. Kind of entrepreneurship, it allows you to do what you're passionate about, integrate your life with your work. Because, and I think when I hear people talk about work-life balance, a lot of times I think like they probably need to be doing a different type of work that they consider to be part of their life
Mhm.
as well. It's kind of a good signal to me that they may be more happy and fulfilled in a different role.
Yeah. I think I was talking to someone recently, and they were talking about how like they're trying to find a co-founder in a space. I think they're in California, but they're trying to find a co-founders in a space, and they're talking to like these two individuals, and one person was like, "Oh wow, co-founder, great!" Like they snapped to it, and another one was like kind of surprised, and they were like, "Oh, I guess the second one really wasn't interested in it." You know, like they like kind of like had to take a step back before they like engage with the idea. And I was like, they probably just didn't even know that was an option. Like talk to him again. Don't write him off. Talk to him again. And they talked again, and they're like they said that they didn't stop talking since we had the conversation, and they like had like this huge plan and everything. But like sometimes like people don't even know that they could do stuff like that. I think a lot of opportunities come from the environment you're in as well. So if there's like startup communities or anything that you really care about, being in that community of stuff, if it aligns with yourself, like you're saying with work-life balance, if it's worked to the point where you think it's separated from your life, if you find stuff that's more like your life and you can be around in those communities, you can find a way to like get in and have these opportunities. Especially as like nonprofits, for instance. Like I think the average age for nonprofits, outside of Sens and stuff, I think they have like very low average age. Like the average age in the Midwest is like 64. So like they're retiring soon. So they're gonna
Hmm.
need like a whole crop of new people coming in. And if you're there already volunteering, like you say, oh hey, Jimmy, I see like you really like it here. Do you want to be the student director of this or whatever? And then it's like, oh wow, work life balance. Like this is just what I do all the time. If,
Yeah.
yeah, sometimes I make the mistake of saying, "I do this for free." My wife tells me to stop telling people that, so they're required to pay me. But
Yeah.
yeah,
Yeah, I think it's more about work-life integration than
yes,
work-life balance in my mind. And also, like, what to say, like, I understand I'm in a very privileged position, and some people are just trying to survive. But but I agree with you. It's like exposing people to the option that this is possible. If they just see it a lot of times, I think we are more powerful than we think.
yeah, yeah. I think it's really fun too, to create the conditions for people to do their best work, to have that opportunity. I think
Mhm.
that sometimes, especially if they're coming from other places, like they don't know that they can. And so if you start like inviting them out and start doing stuff, you're kind of like saying out loud saying, because it's like there's not enough like if you tell people I really care to hear your feedback, and then you shut your door and walk away and never talk to them again, it's like I mean maybe they'll give you feedback, but if you like engage with them and have a conversation, then you'll probably have a higher chance that they give you feedback, and more than that are willing to do a little bit more, like you're saying earlier. Like you're not going to get the best from people if you don't treat them like as adults and
Sure.
the best way.
100%. Yeah.
Yeah. Yeah. So circling back, so one of the things we talked about in the preamble, because we there's like these nice little questions I ask before people come on the show because it helps me and the audience get kind of jazzed up. You were talking about something you wanted to teach people, and I'm gonna like kind of quote. I don't know if it was you or like someone who was translating you, but uh, you were talking about how the AI and precision medicine can really add 20 years to people's lives right now, not in the future, but what's available right now, which I think is an interesting concept. I think a lot of people
Mhm.
do. I think a lot of things are kind of like hype. Like there's just nothing you really can do. You can like maybe measure it, maybe do some stuff. But I think we talked about some of the stuff that you already can do to actively change your life. If you delayed a neurodegenerative disorder by 10 years, that's massive, um, and huge. So what are some of the other things that you think can have a massive impact, like a 20-year regression or improvement?
For sure. So in Wild Health, which I mentioned, so what we do, and we've published now studies on the outcomes of this. Every patient we see, we sequence their genome. We look at about 700,000 specific genes. We do really big biomarker testing, like a massive panel. Pull in all the wearable data, do tons of questionnaires of phenotypic data. We take in these millions of data points, and then we built this AI platform to then be able to say, this is the perfect diet for you based on your DNA, the blood work, everything we have here. This is how we're going to optimize your exercise program. These are supplements that will work for you and which ones won't work for you. These are medications that will work and won't work for you. And what we found is that when you actually tailor someone's treatment down to the level of their DNA and their epigenetics as well, their genetics and epigenetics, you can have phenomenal results. Like I mentioned, my mother in 3 months on that program, getting her the diet, exercise, and everything perfect for her. She lost 40 pounds, reversed her insulin resistance, said she felt 20 years younger. My co-founder's mom, we put him on the program. She lost 80 pounds, got off all of her chronic medications. And we've published on this now, like we talked about metabolic health and type 3 diabetes being dementia. When you look at type 2 diabetes, elevated hemoglobin A1C. In traditional medicine, they reverse that about 3% of the time. You can reverse type 2 diabetes to kind of normal A1C and no longer diabetic. In our patient population, of the people that come to us with prediabetes or diabetes, we completely normalize their A1C 48% of the time, almost half of the time. Incredible difference. The number one killer of Americans is cardiovascular disease. So you think about things like ApoB and kind of some of these atherogenic cholesterol particles. We reduce it through lifestyle and like optimizing diet and things like that, over 33%, similar to taking a statin, similar to medications. So we've published white papers showing that pretty much everything we look at, we get a really statistically and clinically significant reduction in that. And then so to think about how to add 20 years to your life, when you have that level of precision recommendation with AI, you really start to do two things. You slow down the aging process, like I mentioned with the pace, we measure that, and frequently we'll see 10 to 20% reductions in pace of aging. So if you reduce your pace by 20%, for example, like Brian Johnson, we work a lot with Brian. He's measuring his pace all the time. He's got his down to like 0.67, so 2/3 the normal rate. So if you're aging at a pace of 0.67 over 30 years, you're only going to age 20 years. So you're getting 10 years added to your health span if you reduce your pace of aging that much just over the next 30 years. If you have 60 more years to live, then you got your 20 years there. So reducing the rate of aging by optimizing lifestyle, and then also making sure that the big killers don't get you and sneak up on you. Like we all know people who have just all of a sudden got, you mentioned colon cancer, diagnosed with cancer, or just dropped dead of a heart attack and they didn't know it. So we also do a lot of preventative screening. So like for the cancer, we use the Gallery test from Grail. We also use whole body MRIs like Prenuvo. For the cardiac stuff to make sure you're not going to drop dead from a heart attack. Like we've all heard those stories. We do cardiac CTAs, AI guided cardiac CTAs called a Clearly scan. So if you can extend the health span and reduce the rate of aging by that much, and you can catch these other things early so you can do something about them, I don't think 20 years is a stretch at all. I think it's completely doable right now with the technology we have, and we've been doing it. And then to go a little further, the thing that I'm probably most excited about when it comes to kind of AI and doing this is the biggest issue we had at Wild Health in doing this was the cost. Like as someone who grew up in poverty, it really bothered me that most people can't afford all of this. Like it's expensive to have a physician and a health coach and all this. So what we've just done is we took all of that IP that we spent tens of millions of dollars developing, and we put it on top of a large language model, so that now we have an app where you can get your DNA, the blood testing, the epigenetics, the pace of aging, all of that tested. And then the app has those millions of data points about you, and you can interact with it. You can ask it, like I've got it, like a couple of days ago, it gave me an alert that said, hey, your HRV has been trending down and your exercise intensity has been going up. We think you're overtraining. And sure enough, it's like my back had been hurting. I've been traveling a lot. I've been working out too much. My rotator cuff injury was that. And I was like, yeah, I am overtraining. And it has all those data points. And then I said, okay, design a workout plan for me in the next 7 days to help me recover. And it knows my genetics and knows what I should be doing. I gave a talk last week in a place in Nantucket, and I told the app, I said, hey, what should I have for lunch today? And it pulled up a place a half a mile from the place I was staying, told me a specific dish that was based on my genetics. Like I have a FADS2 polymorphism, I need more omega-3. It knows what my lab work is. It knows what my omega-3 level is. It knew that I'd done a 30-minute swim and a 30-minute run that day. It knew how many calories I'd had for the day. So it gave me this very perfect meal for me close by. So to have like a chat GPT like large language model that knows that much personalized data about you, like that's what I really want to get into the hands of people, that I think is really going to go a long way in this kind of 20 years with AI and precision medicine.
So starting in the beginning, when you have this holistic approach, I've always wanted to get my DNA and everything down to the granular level as well, because I'm just curious, like what foods get in the way of me being healthy, or like what is not like optimal for me to like metabolize and stuff. But doctor always says it's not necessary. But so is this like covered at insurance, or is this one of the, because there's a lot of people like Cost Plus with Mark Cuban, where they're finding a way to go outside the insurance and have like it essentially be really, really cheap as well, because they like do negotiations and stuff. So is it covered by insurance, or do you have like really smart plan? You've implemented like a Mark Cuban-esque thing where it's
Yeah.
less.
Yeah, it's funny. I love that it's not necessary comment. Like, what is necessary? Like, yeah, it's not necessary if you don't want to live longer. So don't worry about it. Yeah, it's kind of funny to not want that data. So insurance doesn't cover it. But the cost of like genetic testing has come down tremendously. Like that the app that I mentioned is called Hollis, HOLIS. So if you were to order the genetic test through Hollis, I think it's like $150 to $200. I can't remember exactly, but it's around a couple $100 for the genetic test. It's not like it used to be, which is, I mean, the first time it cost like $1 billion to sequence the first human genome. So the cost compared to, I mean, I don't know how much people spend on lattes in a month, but it's not that difficult and that expensive to get it screened out. And when you talk about like what foods are really kind of messing you up, yeah, just to give you an example, I mentioned my mother. So like to get very specific. So she had to talk about food, like, well, it can identify kind of superfoods and then which ones are kind of kryptonite. So she has an SH2B3 polymorphism. So that means wheat and gluten are very inflammatory for her. She didn't have celiac. It's not celiac, but it's just very inflammatory, but she doesn't know it. It's causing a lot of issues, increasing risk for dementia. She had an MCM6 polymorphism. I mean, dairy is also inflammatory for her.
Mm.
So identifying kind of kryptonite foods for her. And then when it comes to what should she be eating, it's a combination. So she had a FADS2 polymorphism, meaning she needs more omega-3 instead of the plant-based form, which is ALA. She had VCMO1, more vitamin A, VDR needs more vitamin D, collagen 5A1 means she needs more collagen protein. So the AI bring those together says, okay, the perfect food for you is sardines. You got the omega-3, you got all the collagen protein in the bones, you got the vitamin A and D in the little organs. And that's like the world's perfect food for you. Now, if she's not going to eat that, then we still know she needs those things, and we know what her blood tests show, and we can fill those holes in other ways. But having that data, you can figure out what are going to be the perfect foods for you, which ones should you avoid.
Mm-hmm. And so is this a thing that you'd want to do monthly to track? Would it be a one-time thing where you could know all this information and just assume you've made the corrections, like knowing that this is good food, this is not good food? Or is it something that you'd want to do over the course of a year with a couple of tests?
Yeah, so the genetics is once and it's ever, it never
Mm-hmm.
changes
Yeah.
again. The things you would want to repeat are the blood tests. So for example, if we have those genetics on her, but her blood test shows that her omega-3 level is great, well, then she doesn't need to eat more omega-3. Whatever she's doing is enough. She's
Mm-hmm.
solving that problem epigenetically. Whereas if her omega-3 levels were low and she had that SNP, we want to increase the omega-3 content of her food. But then when those levels come up, that's not the biggest need. So looking at her blood test again, now what is the issue? Now what is the problem? So the blood testing, usually kind of every 3 to 6 months, the genetics once ever,
Yeah.
and then usually kind of the epigenetics, the pace of aging thing, is every 3 to 6 months as well, to see just kind of an integrator of everything. How is your rate of aging?
Yeah. Is it so for your LLM model, are people able to upload their data into it, even if they're not a part of your system, and then get similar stuff as long as the test quality and stuff is like approved? So it's like it meets your criterion, they can like upload and they can still get the information.
Yeah, good question. So, like, if someone was to download the app, first off, it pulls all data from Apple Health and Google Health. So you just got to give it the permissions. So all your wearable data, so all your activity, all your sleep, your recovery, all of that is pulling in. You can log your food super easy, just talking to it and saying it calculates all the macros. So it's tracking all your nutrition, sleep, and all that without any tests. Then, if you want the genetics and lab work, you just order them in the app, and the genetics come to your house. You send it back. The epigenetic pace of age comes to your house. You send it back. The lab work you order, you just go to a local lab core, and they've got the order just through the app, and so you integrate all that in. You said, can you upload your data? You will be able to soon. So it's on the
Mm.
roadmap. We just released it. It's in beta in the App Store, in the iOS App Store. Uploading your own data. We built it to where you could get all of that data. And with labs, like, you want current data anyway,
Yeah.
and genetics you just want once. So we felt like it was okay to get it through the app. But in probably the next 60 to 90 days, you'll be able to upload your own as well, because we want to be able to
Yeah.
feed it as much data as we can. The more data it has, the better the recommendations it gives you.
Yeah. Yeah. The is this so it'd be like a subscription model for people to use it? So it's like, like $10 a month or
Mhm.
something, and then people have access to it and do everything they want to do.
Yep, that's exactly right. Yeah.
Sweet. Yeah, that stuff's crazy to have all that resources in one place. I know I think there's like some concerns on privacy and stuff like that,
Mhm.
but I mean, a lot of it's anonymized, and like the LLM itself. Like I think I was reading a paper where you couldn't reverse engineer the data that the LLM's been trained on based on its outputs. So like it's like anonymized data. So even if like your data is used in this way, it's not like it's revealing in some way. Like if you like everyone in the U.S. had like their social security numbers breached. Everyone should put like alerts on their credit cards and stuff, like their credit and stuff, just as like a safety precautions. But and like there's no way for there to be like an equivalent for this type of data, which is kind of nice in terms of the privacy of it.
Yeah, yeah, it's a good question, and it's a concern, like the privacy and data. Um, I I want to be safe with my data, and I like to think about it a little bit, but in the end, I've kind of come to the conclusion, like, if somebody wants my data, they're gonna get it. And I want to get as much benefit from my data as I can. So
Hmm.
I love it when I'm able to kind of take control, at least, like I'm using my data for my benefit, like I'm using in the app right now.
Yeah. So you have that product that you've developed. Are there other things coming down the pipe, or that are if you can't tell them, tease is fun too.
So if I think about what I'm most excited about coming down the pipe, that's related to True Diagnostic, actually. So we so there's the biologic age test, the pace of aging test. The pace of age test is great, very useful. But the most exciting thing for me is, and this is unpublished data. We did a collaboration with Harvard. We've been working on for about a year, and I think we'll have a preprint probably in the next 30 to 60 days. So hopefully I'll be able to talk about it soon. But we had a thesis. So when you get these biologic age tests, the way what we're using is looking at epigenetics and DNA methylation. So when we sequence your DNA, that's your operating system, human operating system. But that only accounts for 20% of your health outcome. The other 80% are epigenetics, how you turn all those genes off and on,
Mm,
what you eat, how you sleep. You're turning genes off and on, turn them up and down all the day, how you express them. So that's what True Diagnostic is looking at, is the expression of these genes, how much they're methylated, how much they're turned up or down. So we look at about 1 million specific genes. How much is it turned up and how much is it turned down? From that, you can get an incredible amount of information. So not only can you get the biologic pace of aging, but it's been proven to, like, if I were to ask you how much you have smoked in your life, you tell me, or you give me a drop of your blood and I run this test, it's going to be more accurate than your report of how much you smoke it.
mm,
It can say what zip code you spent most of your life in based on the pollution biomarkers. So
wow.
it can impute nearly anything. It's like you're only limited by the size of the data set and your imagination, because what you can do, like right now, the listeners to this, listening to this, whether they're annoyed at how I'm talking or it's soothing to them, is going to cause different expression of their gene, whether they're sitting or standing. So if we had 10,000 people listening to this and we took all of their blood right now, we could probably find the epigenetic fingerprint of what it looks like to be listening to the Learning with Lowell podcast. And so you could
That's
have a
funny.
test for that. Is someone listening to this podcast or not? So you can think about the implications of this. For example, neurosyphilis. If I'm
Mm,
concerned you have neurosyphilis, to get the answer, I've got to send you to the hospital. You got to get a lumbar puncture, so spinal tap. It's painful. There's complications. It's several $1,000s. Or take several hundred patients with neurosyphilis, several hundred controls, get their blood, find the epigenetic fingerprint of what your body looks like when it's all how you're expressing your genes when you have neurosyphilis. Now you have a drop of blood test for that instead of a lumbar puncture. So we did a study with Harvard looking at the top 8 diagnoses in the US. They have a 100,000 patient biobank. And what we did
wow.
is we would find like 3,000 patients with cardiovascular disease, 2,000 patients with depression, and get their blood samples with these diagnoses, compare it to controls. And our question is, can you find the epigenetic fingerprint and have a few drop of blood test for cardiovascular disease, COPD, depression, all these things? So I can't tell you the results yet, but I'll tell you when I got the results, I remember, I'll never forget where I was. Like they
Mm,
were really, really interesting. And the other thing that we looked at with this is even more, is like, if you can predict these diseases, what about the biomarkers to them as well? Like your CRP, your cholesterol, these things. Can we impute like different levels of that from epigenetics? And what I can talk about is, just on Sunday, there was a study that came out that showed that you can have these proxies for these biomarkers. And in fact, in this study, what they showed is that some of those imputed or predicted biomarkers, like for CRP, perform better than the actual CRP, which makes sense because if you think about CRP, it bounces around all the time. Your glucose, I don't care what your spot glucose is because it bounces around. I want to know your A1C. It's an average over time. So it looks like these proxies are an average over time that maybe better measure the biologic effect.
mm,
So again, I can't talk about our results yet, but in the study that just came out, they found that those were actually better than the other biomarkers. So we looked at about 4,000 proteins, metabolites, and other things and said, can we predict these with epigenetics, with this big data and AI? And I was very excited about the results of that as well. And
mm.
when we do get the preprint out, I'll send it to you so you can see. But that's what I'm most excited about, to have potentially have a test, just a few drops of blood, that could diagnose all of these diseases and give you all these biomarkers. Because like if we diagnose you've got chronic kidney disease on this, well, what's it from? Is it glomerulonephritis? Is it like an infectious thing? Is it a genetic thing? There's different tests for that. Well, if we can also predict all the biomarkers that you would use to test that, then we get even more granularity. So
Mm.
epigenetics and DNA methylation is the future of testing. And I think when these newer studies come out, people are going to realize like the future's a lot sooner than we think.
Wait, is there I imagine there's probably a list of tests that you could develop and you could order it based on like its importance or like rarity, like the scarcity of existing tests or like the accuracy of them. For instance, like Alzheimer's, I think that there's not really we're still developing like an accurate test for it, I think, other than just like doing like a like an examination. I don't think you can like do like an MRI or something to diagnose it. So I'm sure there's like a test that you could do there. I know Michael J. Fox, in terms of just like a database of biobank, I think they have a massive database, and they're always looking for stuff too. But are there tests like a hierarchy of tests that you guys want to hit in terms of developing it with the system?
Yeah, and so then this has been done a little bit already. So like
Okay.
I mentioned the Gallery test for cancer,
Mm-hmm.
it tests for 50 cancers. This is what it uses, DNA methylation.
Mm. Okay.
Um, the Cologuard test from Exact Sciences, it's a DNA methylation test. So a lot of people are doing it for cancer. What we want to do is do it for everything else. So like you mentioned, like Parkinson's with Michael J. Fox, like if you had just a big enough data set, you got 1,000 patients with Parkinson's, you probably could find that epigenetic pattern. And the interesting thing too would be to find Parkinson's patients where you've got a blood sample maybe a few years before they developed it too. So you'd want to get the early diagnosis, see if there's like an early signal or a pattern there you could find in the epigenetics and DNA methylation. And dementia, like you mentioned, there's not great tests for those. You have certain brain imaging and things. But if you were to find people with dementia and go back in the biobank and see if you could find a signal like 5 years earlier, then that would be really helpful as well. So yeah, you can imagine you're probably already imagining like what you could do with this. Like it's a lot you could do with this testing.
Yeah, I think on average in the U.S., if you have an undiagnosed illness, it takes 7 years to figure out what it is. I think it's like 5 to 7 years to figure out what it is. And in that whole time, they're pumping you with random drugs and random things, trying to figure out what it is. Maybe it's this. We're gonna try. If you ever seen like an episode of House, if you imagine from the patient's point of view, it is not an enjoyable experience. And imagine that over like 5 to 7 years, it's not a fun experience. So I think this
Yeah.
idea that we can have that specificity really quickly and be able to like hone down really, really fast, maybe especially the granularity of like if it is an illness, like what type of it, where does it come from, what are the ways to, and then that immediately gives you, oh, well, now we know how to treat it, or we have some ideas on how to treat it. Kind of like I see the power of that immediately.
Yeah. It's precision medicine like that. That's future
Yeah.
of medicine. Like right now, you mentioned like on the 7 years thing. It's a trial and error. It's a data problem too. You come in and you have a 7-minute visit with the doctor, and they're pretty limited on what they can order because you asked earlier about kind of insurance, which it's going to reimburse. And so just you can get a very limited data set, but to collect all the data at once and then have like the machine learning to be able to combine it all and find the patterns and make the recommendation. That's the future for sure.
Yeah. People say this 7 minute thing. I get like a yearly physical and it's an hour. So I think you just need to find a better family doctor. I think there are ones that I have been to doctors that are 7 minutes, and I say all right, and I reschedule with a different doctor. And I
Yeah.
ask how long do they spend with their patients on average. Because I drove an hour on my way to see like a cardiologist. He was 40 minutes late. He was only there for 7 minutes, and he didn't listen to a single thing I said. He just sat there staring at the nurse, and I was like, I mean, I get it. She was pretty enough, I guess, but like, I mean, you're here to help me with something. It's like you think you would like, I don't know, went through 20, all that education to not pay attention to someone's heart. But yeah, I see the potential of it. So I think my guess would be like there's going to be like a massive like hiring thing going on at True Diagnostics, because you're going to need people to develop partnerships and get more data coming in. So getting access to those data lakes so you can create more tests, more opportunity in terms of how you can help people.
Yeah, we're also always looking for data and collaborations. I mean, like I said, we've worked with Duke, Mayo, John Hopkins, Harvard. Like we're always any universities or anything that want to do this research. We also created software to be able to allow and empower other researchers and universities to be able to do some of these studies. So we're always looking to collaborate. Like we think this is the future. We want to accelerate it as quickly as we can. So yeah, if anybody's listening to this and they're a part of a university or some system that wants to do DNA methylation research, it's not easy to do because like right now when you sequence, you get those million data points on the epigenetics. You just get this kind of like raw like IDAT file of all this, and like there's QA, QC normalization, and then turned it into an actual report and something usable. And we had to create that software for ourselves. So we're now actually empowering a lot of other places to do the research too. So yeah, we would love to work with others to push it even faster.
Is the intention to keep True Diagnostic a complete software company, or do you guys see any opportunity? And this is like slash like what are your future plans outside of software? Do you see yourselves becoming a bio database, or like creating data sets of your own, like collecting that type of information for unmet needs that you see in the community?
We already are. We have the biggest data
Mm,
sets of like DNA methylation. We've got tens of thousands of patients we've sequenced, and we're a full lab. I'm sitting in our lab now. we're a massive lab doing all the sequencing, and then the software honestly was kind of we had to have it ourselves, and so then
Mm,
now we're like we should definitely empower other people with this, but we're a lab and a data company and a discovery company right now.
yeah. So just like a general, is there any other? I think that's pretty tight. Like you focus on that, you're gonna be able to do a lot of great work. I'm just curious, is there any other kind of like that Google umbrella thing? Is there anything else that you guys think you're gonna be up to?
I mean, I feel like this one test to rule them all, like having a few drops of blood to diagnose everything, is probably big enough for me at least.
Yeah,
So if you got some other ideas, let me know. We can work on those too. But right now, I'm like, man, this could like change the world. Like this is a really big thing. I mean,
yeah,
think about it, just the cost. I mean, if one test and then you've got all of this data from it, you think about like in resource limited settings to being able to do it for such low cost because you have so much data for one sample. This is what we're focused on for sure.
and it's just like a cheek swab type thing, right? Like I don't think it's like you have to get like a lot of blood.
No, it's a finger stick. So there are a
Okay.
lot of companies do like biologic age testing and they'll do it with saliva or swabs. Those just haven't been validated. They're not good enough. And so we would love if it was just saliva or swab. It's just easier, but no, it's a
Mm,
finger stick. It's super easy. It's a little finger stick and you just squeeze a couple drops of blood out on a dried blood spot card. But yeah, it's blood just because that's what's been validated and been proved to be the most accurate.
yeah. It's like the like Theranos, but does what it says and is not evil. It's like you guys have actually developed a thing that Theranos just like spent the whole time just pretending that they could do.
Yeah, it's
Um,
tough because sometimes when I describe it, people are like, that's what comes to mind is Theranos. And I'm like, no, come to our, I'm literally saying, come see our equipment. Like and we published everything. So the
mm,
Theranos, like that's an issue like in these Silicon Valley, like high flying companies, they'll like use like IP and like all this
mm,
is an excuse to not actually show what's going on. But everything we do, like we're publishing, we're doing it through university collaborators, not on our own. So it's like they're the lead author on it. We're just supporting and like using our data sets and things. So we try to be very upfront and just publish everything and get it out there. And you can come see our lab. It's not a black box.
yeah. Yeah, no, I think I don't think in this space a Theranos could happen again because people are so like wise to
Yeah.
it. And additionally, it seems like you guys have done specific work to make sure that that you never be perceived that way. You know, all the openness, all this type of thing. It's like very uh counter to everything they did. They love the secrecy. They
Yeah.
loved that. They just like, you know, the doc I think it was a documentary or a TV series on Hulu with
It's bad
but
blood.
they capture, yeah, like it was based off Bad Blood.
Oh,
I think maybe it was called
okay.
Bad Blood. It had a really fantastic actress in it. But you can see just like she's, you know, the right charismatic person could do stuff. But yeah, I wouldn't say from my appreciation of what I've heard so far that you guys are anywhere near that at all. It seems like you guys are actually like doing good work versus like I what did they ever do? I don't think they ever actually did anything, and that's a big
Yeah.
litmus in of itself. They were open for a very long time. They never developed anything. You guys have developed stuff, and like you're actually showing it. So
They faked a lot of stuff and they
yeah,
raised billions of dollars. But you're right, no one could ever do that again. And in fact, it makes it harder for legitimate companies to do things
mm,
now. We're in a situation where like when this publication comes out, we're gonna like really be sprinting towards this. We're gonna hire a lot more scientists and engineers and things. And so we may be in a situation where we may raise money like in the next year or so. And like Theranos makes it a lot harder. Like when you've got something really big and like it's like almost unbelievable how good it is. Like yeah, they made it difficult for sure. And so you certainly couldn't do it again. Yeah. They
I
fooled
think
everybody big enough.
the difficulty makes it easy for you to do your job, though. You know, if it's difficult for a bunch of people to replicate, like one of our earlier things we were talking about, this idea that when you're doing a great job, it makes it really easy for people to think, oh, I can do the 4 minute mile too now.
Mm.
But that difficulty from the investor point of view of having to like show their due diligence and that type of thing, and you have mountains of due diligence, it seems to me like that would be really more of like a not like marketing, but like a communication thing. Like, how do you communicate it succinctly enough for an investor who's gonna be able to internalize it fast enough to realize that you guys are the real deal versus like the copycats or the people who aren't really doing the due diligence, like doing the hard
Yeah,
work.
no. No, you're right. When we get to that point, if we decide to raise, I'm not worried about it just because of the level of like publications and science and things. So you're totally right.
Yeah. So in the health field, outside of what you guys are working on, are there developments that you're tracking that you think are really exciting? So uh, I'll give some examples, but like yeah, as a physician, you seem like a nerd, no, like in a good way.
Mhm.
So are there things that you're tracking?
Yeah, no, I'm much more comfortable be calling a nerd than talking about the being on the Kardashians. So no, it's no offense with
Yeah.
that at all. Um, uh, so obviously, like longevity molecules are always exciting. Like clearly, the thing I'm most excited about is what I just talked about with the epigenetics. Um, but I'm always watching for like new longevity molecules, whether they're going through the ITP, the interventions and treatment program, and what's new and what's coming out there, so that I can take it, so I can give my patients it as well. Um, so there's certainly new and novel molecules. I think also in epigenetics itself, like epigenetic reprogramming and therapeutics related epigenetics is a really exciting space. There's some really interesting companies doing things in epigenetic reprogramming. Um, there's some, you've probably heard of Yamanaka
Mhm.
factors. I was at a conference earlier this year where part of the conference is you actually sign a thing saying you're not going to talk about stuff because it's pre-published stuff. But the progress that's been made on that and kind of reversing aging in the specific like cardiac cells or in the eye or things like that. I think David Sinclair, he was at the conference. I think he's talked about publicly about some of it if someone wanted to kind of Google that. But there's some just really interesting things coming in the fields of therapeutics when it relates to Yamanaka factors and epigenetic reprogramming.
Do you are you it seems based on the vibe you gave regarding the Alzheimer's and dementia and the interventions we can do and the advancements that we're having in tests and all these other things. I've heard a number of people say that and I've read some like some scientists talking about how like they think that like an actual like effective treatment for Alzheimer's is maybe 5 to 10 years away, which is like if you hear something that's like 10 to 20 years away, they're just like trying to get funding. But if it's under like 5 to 10 years, like it sounds like they might have like a toehold on things. I am not a doctor. I should have said that in the beginning. So I just read a lot. What is your take in terms of us being close to an actual treatment that'll help people?
Yeah. So with dementia, it's such a multifactorial thing. So I mentioned Delbres and the Alzheimer's and just like 36 holes in the roof to patch. So like with my grandmother, I mentioned her, like we first saw her, when I first saw her, she had a MoCA score, Montreal Cognitive Assessment score of 16, which is moderate Alzheimer's. And the goal with this disease is just to slow the progression. So you want the MoCA to go from 16, 15, 14, not go 16, 10, 5, not fall off a cliff. So when we started treating her and doing this holistic approach, not a medication or a molecule, but it's a holistic approach and optimizing everything. When I saw her back a few months later, her MoCA went from a 16 to a 20. So 25% improvement, which is not supposed to happen. It's just supposed to slow the progression. So I think focusing holistically, because that's how
Mhm.
you get Alzheimer's disease, it's not one thing, it's all these different things. I think right now that's by far the best thing we have. And I've seen like people get
Mhm.
better and delay it and things. As far as an actual molecule, we've spent billions of dollars trying to develop it, and it just nothing is working. There's been a couple things that have been approved that they could go on a rant about how I think they probably shouldn't be, like just the because just their efficacy is not that great. And so I don't know, like the treatment for it. I think taking a holistic approach is the best thing right now. I think some of the stuff kind of around like Yamanaka factors and epigenetic reprogramming or some of the things that kind of holistically reverse aging may be useful, but Alzheimer's is also like an accumulation of a lot of damage. And I'm not sure if we're going to be able to target that specifically. So I don't have a great view on if we're going to get a really great
Mhm.
treatment in 5 to 10 years because we've been failing for 40 years at it at this point. And the best predictor of the future is the past. And so I think right now the best that we have is this kind of holistic approach and really taking a whole person approach to it.
Yeah. So related to biological age, this is a question I wanted to talk to you about. So I wrote down the whole question, which is nice, so I can just read it and not hopefully my dyslexia doesn't pop up. So knowing your biological age can be a double-edged sword. What are the potential psychological downsides? How should people cope if their biological age is older than expected or it's just not what they're looking for? I think they're like the most like colloquial way of thinking of this is like someone's trying to lose weight, they step on the scale, they're not seeing the numbers go in the direction they want. Similarly with an age, if there's like targets there. I imagine if Brian Johnson spent all that money and he, went the opposite way, he was like tripling his aging. Like I bet that would like feel pretty terribly. So like, how do you see like the psychological downsides, and is there anything that people should do to like mitigate it, or anything that you guys do to help people if there is like stuff going on? Like I could see like a flagging, like if it's like if it's accelerating, you guys flag it and say, hey, speak to our like counselor or something like that to help you out or whatever. But yeah, I'm just curious what your thoughts are.
I think you have to know yourself. And I think you have to like go back to the basics and think about like, why would you ever order any test? The reason you order a test is to get data. And the reason you want that is because you're trying to change the future, whether it's live longer or be more healthy or whatever it is. So to me, like data is always good because
Mhm.
it's either going to be a motivational thing for me. It's going to push me to like, oh, something's going on here. I need to take this seriously. Or I'm on the right track. Great. Let's double down on that. So to me, data is always better. I totally hear what you're saying though. I mean, a lot of times we'll have patients who like they'll be wearing an Oura ring or a Apple Watch where we're tracking their sleep, and they get in they get in their head about it. And it's disrupting their sleep because they're laying there and they're like, I'm not falling asleep, and then they're like more spun up about it. And I say, just take it off for a while. That's fine. So if you're a person that if your epigenetic age comes back higher, it's going to be demotivating to you. It's going to get you down. Well, then don't do it if there's not going to be a positive outcome. So I think you got it. For me, data is always better, but I think
Mhm.
know yourself. And if you're going to respond that way, either figure out how not to, like, like, um, or don't do the test. Like, I think that's totally fine. If it's going to harm you and not help you, don't do it. That's what I'd say.
Yeah, I think they're the ApoE4, I think it's the one for Alzheimer's, and Chris Hemsworth has that, and I think there was a bit of a thing in his documentary that he was doing about whether he would take it or not to see. And I think it's like I think it's Huntington's as well. It's one of those like horrible genetic
Mhm.
ones where Huntington's is like even worse terms of like
Yeah.
the outcomes. Um, like the fear of it, like could it affect your life? Like would you, it's like that psychological or like philosophical question of like if you knew when you would die, would you want to know? And it's like I think like that's like pretty hard, but like knowing that you have a higher risk means like you could do something about it, I think.
Yeah, and there's different variations, like in degrees. Like ApoE4, that's the one I mentioned my mother has. And when we found that out, what I said to her is like, Mom, great news. We know about this thing and we're going to prevent it now. Like if we hadn't done this test, you would have kept going on with your life with your
Mm,
insulin resistance and being overweight and all these things, and you would have ended up like your mother. But we have great news. We know this. We can do something about it. So that one in my mind is somewhat clear. The Huntington's disease is a little harder because it's a little more deterministic, and so there's not quite as much you can do about it. And so then it's a personal choice. It's similar to the thing of like knowing the day you're going to die. Like I'd love to know both of those. Like I'm not because to me it helps me prepare. I've got a family to think about and take care of. I have other responsibilities and other things, and so knowing that would not have an I believe, and this is, it comes back to knowing yourself, would not have a negative effect on me. It would be information that I could use to optimize the situation for myself and my family and others. But all of these things are a personal decision around ApoE4, Huntington's. If you could actually know when you get a biologic age test, and again, I think it comes back to like knowing yourself and your mental state and how you respond to information.
mhm. So I think I imagine from your guys' point of view as a business, the white papers and all the information you give out is kind of your not necessarily a disclaimer, but it's like, hey, really educate yourself before you do the test, and then these are the outcomes that you can get. So like you're very like upfront about like the potential downside or upside of what they're going to be getting.
Yeah, I think the upside is tremendous. If the downside is a little bit of psychological stress, like we're getting the test so we can do something about it. So I think we're not just getting it to tell you about the future. We're getting it so we can have an effect on it. I mentioned earlier, your DNA is not destiny, and it's just about 20% of your health outcome in general. The rest is epigenetics, and so we just want to see what the risks are so that we
Mhm.
can then do the things we need to avoid those risks.
Yeah. Do you think there is? I doubt so much in America, or there's examples of this in America. I don't think there are. If there are, please say something. But I think like this dystopian like Gattaca type future where like people are screened out of jobs or opportunities based on tests like what you're talking about developing. I don't think that would really. I don't think that flies. I don't think that has happened yet. Like insurance saying like, oh, you have to do this test, and based on the test, you like that's where your coverage is going to come from. Um, like overall in America, insurance actually got like people are pretty upset about insurance generally, but insurance has gotten better over time. Like I think in the '90s they had caps, like lifespan caps on insurance plans. So like, and moms used to do they'd crunch the numbers on their kids that had illnesses, and they would feel like, oh well, by the time he's 8, he's gonna be off this insurance because he's reached the cap, and now he's either not gonna be able to get the medication he's gonna need to survive, or we have to go to new insurance, which is gonna have a higher premium, and all these other things. And now they can't do that. There's like lots of stuff that interventions it. So like I'm kind of like biasing you a little bit and like like I feel like in America like if this was a thing that came in there, I think people would just start like burning stuff down. But how do you feel about the likelihood of like a Gattaca type situation or like these types of dystopian elements, the downsides of what we're developing with technology nowadays?
I think it's always smart to think about them. I mean, we're having these discussions with AI right now. What are the downside risks? Like, if we don't talk about them, that's not good. We don't want to bury our heads in the sand. I agree with you though. Like, there have been laws put in place about insurance not discriminating against you based on genetic things. As we get more data and information, it gets more complex. Like, there'll be more laws put in place to protect
Mm,
people. I think in general, more data is good, and the value that we get from more data is probably worth going after, and then just putting regulations around it so it's not misused. Like, anything can be misused. Like, anytime there's incentives, like, it can have unintended consequences. So certainly good to think about. But I think we'll get it. I think we've gotten it right in the past for the most part, and I think we'll continue to get it right.
yeah, I think we're averaging in a good direction. So one hidden talent, and I was really surprised to read this. If anyone is, you're welcome to guess as I'm about to read this what you think it was going to be. But you won second place in an international breakdancing competition. So I'm curious to hear the story behind. I want to hear the story behind the story. Like, how do we get to the point where we're even in a dancing competition?
Yeah. So the story behind the story is that I got that question. I was in a funny mood and I just totally lied and made that up. So
Okay, is that
yeah,
true?
it's funny.
You never.
I don't remember answering that question, but that totally sounds like me. Because I also think it's funny to like have a joke with someone who I've never even met, and it could be inappropriate. That just makes me chuckle a little bit, just to lie to someone who I'd never met before um, about that. So no break dancing competitions for me. I'm your
Okay,
normal white guy with no skills in that, that department at all.
the, there are three follow-up questions off of
I'm
it. So
sure those are.
I was
Oh,
gonna ask you what you
about
thought
the
about the.
dancing.
Yeah, yeah. I was gonna say, like, what'd you think of the break day? Like, there's like a thing going around on the memes for like a break dancing in the Olympics. There's like a person in like green outfit and they like broke dancing really great. I was just gonna ask you your opinion on it. So your lie was funny. It worked out.
Well,
There's
now
a
I
whole
feel
thread.
bad. I didn't know you actually prepared more questions about it. I feel really bad
Yeah,
now. Sorry about
no, it's
that.
fine. I don't. It's making me laugh, so I don't care. It's not like it doesn't offend me. Um, I mean, unless you like, are you a fan of the Olympics at all? I literally only learned enough to ask you the question. I don't know the Olympics. Are you following them?
Yeah, I really enjoy the Olympics every time they come around. So yeah, I had fun watching this year. I didn't actually see actually they call it breaking, right? They don't have the dancing word out of it. I think it's called. I actually didn't see any of that, but I noticed it was in the Olympics, and I was like, what? Break dancing is in the Olympics now? It's just kind of awesome.
Is there a sport that you don't think should be a sport in the Olympics, or do you think most like anything that they feel is okay to have a competition is cool to be there?
When I saw like breakdancing in it, I had that thought. I was like, where are we going with this? Like, what's next exactly? But then I thought, like, no, it's fun. Like, these people are the best in the world at this. It's fun to watch. And I remember watching a couple times like some of the badminton and ping pong. And it was like I was out to dinner with my wife, and it was like the ping pong playing, which you would think like watching ping pong would be like the most boring thing in the world. And I was captivated by like these guys, like just the incredible like intensity of them playing and stuff. So when I think about like how amazing it was and how like distracted I was by that ping pong across the room, I feel like anything where you get like the best people in the world at it, it would probably be fun and entertaining. So I don't have a problem with the sport creep, I guess we could call it,
Mm,
in the
okay,
Olympics.
yeah. So
I don't know.
you'd be
What do you
fine.
think? What sport
For
do you
being
think should?
added, well, I there's like a bit of like I feel like there should be like a core Olympics, like where did it
Yeah.
come from? What's the point of it? Like there's people in ancient Greece and stuff like that. So I think that'd be kind of fun. And there's like rungs of it, and because like the rung structure, I think would be great because then you can have like Japanese game shows, like where they have like a person like they gets like knocked off a ball and they have to like jump around and like stuff like that. Like there could be stuff like that that could be kind of fun too. That could be like Olympics adjacent, like Olympics light, how they have like Star Wars for kids, where it's like a bunch of little like people running around and
Yeah.
stuff. So I would like the core stuff to be like have like an asterisk or like some type of like metal on it, and then like maybe there's like stuff that's like so like Dante's Inferno, like the layers of hell. But like there's some stuff that's like either like so extreme or so silly, but it's still a competition. People are like doing their best to win. That I think would be fun too.
Okay, so if the International Olympic Committee is listening to this, I actually have a suggestion and a
Okay.
submission for sport because I invented the sport. And I'm
Hmm.
convinced it's the greatest thing that humans have ever invented. So it's called speed pickleball. So I'm really into pickleball. I
Hmm.
played tennis in college and I didn't play for 20 years, and I started playing pickleball. It was just so much fun. So one day my friend and I, we only had like 20 minutes. We wanted to get a good workout in. We were at a place that's pickleball. I said, let's play speed pickleball. The rules are you never stop. You just go, go, go. You're sprinting. Whoever server it is goes. You don't have to wait for the other person. And it's so intense. And it's like the best workout of anything I do. And it's like the funnest thing I've ever done. So if the International Olympic Committee is listening, forget pickleball. Don't add that. Speed pickle is the funnest game
Speed
ever.
pickle. That could be the
Speed
name.
pickle. And
Speed
it's
pickle.
yeah, yeah, that's what
Yeah.
we call it at least. I'm like constantly trying to get people to play it with me.
Hmm. So I'll play if you're ever around me. I've never played pickleball, but I'm always up for a challenge. I think there's a game I play with my friends where we take like those giant big medicine balls that weigh like 40 pounds,
Yeah, yeah.
and we chuck them at each other as hard as we can. And is we call it hot potato elimination. And so you have to like it works with there's four people. Uh, Usually it's like one person getting ganged up on, which is usually it's me because I can last longer than everyone else. But you basically we throw the ball back and forth. And the idea is to keep going until you decide to be eliminated out, and then you can step down and you've been defeated. But then you like throw it back and forth, and that's it. It's basically just like who can stand throwing a 40-pound ball 20 feet as hard as they can at another human being. So it's like slightly dangerous, but not really.
So we used to play what's called monster ball, same thing, but in a volleyball net, and you're
Mm,
throwing it over, and you got to catch it, and it's just really difficult. And it reminds me of I used to where we had our main office at Wild Health was on a farm. I had a big heavy ball, and I was get so busy, but people would always want to talk to me. They had ideas, and so I created a rule for a while where if you wanted to talk to me, we had to go out on the deck and pick up the medicine ball and throw it back and forth. I had to be throwing it back and forth the whole time. So it really eliminated the unnecessary conversations and
hmm.
shortened the conversations a lot as well. So medicine, but all kinds of uses, like your
Yeah.
game, yeah, all kinds of things.
I have thought about like adding a component like that to this show. You know, like they have hot ones with spicy wings, and like you have all these like kind of like fun things for like people doing exercise or something. I thought like, what if I added like some level of discomfort? Then it'd be like kind of entertaining. Like imagine asking like you or George Church like really serious questions, like pickleballing them at the same time. Like
Yeah.
it's like I feel like there'd be like some amusement there, but it'd probably be only amusing to me. Um, yeah, so Speed Pickle is something I'll check out. In terms of books, you've referenced a couple of them over at least one throughout the show, which I'm going to check out. Are there other books? It doesn't have to relate to the space. I'm reading just like to like preface you and give you a second to think about. I'm reading where is it? I'm reading Crime and Punishment right now, and Moby Dick, and then a book on Native Americans in Michigan, which is pretty cool actually.
That's cool. Yeah. So if I think about the book that I'd recommend the most or like give away the most, there's my favorite book on leadership is called The 15 Commitments of Conscious Leadership. And it's honestly, it's probably a book more about consciousness than leadership. It's like framed in the frame of leadership, and consciousness is probably the only thing I'm more interested in than health and longevity. But it's great. And I met the author. He and I both spoke at a conference last year, and we become friends. He's just an amazing guy named Jim Detmer. So there's that book. And then the other one that I constantly go back to is written by Anthony DeMello, a Jesuit priest. It's called Awareness. And it's
Mhm.
just, every time I read that book, I just get more out of it. So those would be two that I definitely just read a lot.
Are you familiar with superorganisms like ants and bees and stuff like
Mhm.
that, where they kind of have like a like pseudo consciousness?
Yeah.
Do you think they actually are conscious in the similar way that we're conscious? Like basically the ants are like synapses and stuff like that, or do you think there's like a special like quantum or whatever in the human like skull? Like where do you think consciousness comes from? And then if so, do you think ants and these other type of weird organisms would have a form of consciousness?
Yeah. I mean, consciousness is called the hard problem because it is the hard problem. So it's funny, like
Hmm.
when I listen to people like Sam Harris and just Goldstein, like other people like that talk about consciousness, to think about me postulating what it's from, where it's from, just kind of makes me laugh a little bit.
Hmm.
I think it's something. I don't think it's an emergent thing like the colony per se. I think that's something else that's happening
Hmm.
there. I think consciousness is something like core and deeper that words can't describe, that's always there, like how it, and we become aware of it. But and I realize like the more I start talking about it, the more it's going to make less sense what I actually think about it. But I
Mhm.
certainly enjoy thinking about it. I think it's the most interesting problem we have. Like, what is it? Where does it come from? Those
Do you
types of
think there's like
questions.
a like the Descartes dualism where you think there's like the physical structure and then there's like a separate thing that's like almost like a spiritual level to like what consciousness is? It's like spiritual is like yeah, like the dualism.
So no. So I just like because the reason why I say no is because
Hmm.
I think dualism in itself is like kind of gets it wrong. So I started reading a book by A.H. Alma's called Facets of Unity. And it's
Hmm.
about unity and oneness and the different facets of it and what it means. And there's different explanations, different levels to that, but they all are kind of the opposite of dualistic separation of mind, body, or separation of whatever. So I think there's like an underlying substance that is everything, and kind of more of a oneness there. If I was going to describe consciousness more than like the dualistic way to think about it.
Hmm. Okay. So do you think AI could be conscious? Like, do you think there's a like if you term human level consciousness, do you think AI will be conscious like we're conscious, or do you think it'll be like a dog or something?
Um, so do I think AI will become conscious? What I would say that is no. However, I also want to say 100% that I don't believe most things I think. So for me to like and I love that saying, like, don't believe everything you think. Because I think that's a problem in general. So like I'll give you like just a response that I don't think AI will be conscious. I think it'll be powerful enough
Mhm.
that it'll certainly seem conscious. I mean, it already does in a lot of ways, but I think that's fundamentally different than consciousness. I think the appearance of consciousness is not necessarily consciousness, and I think that's what we're going to get with AI.
Yeah. Do you think and this is my last philosophical question because I've heard you say like this isn't your arena, but do you think that consciousness like do people have free will or do we just have the feeling like is consciousness? I think there's like a theory or thought process that people think that it's like a trick. We're tricking ourselves into thinking we're conscious for some benefit, but we're not actually conscious. We're just like dogs and stuff.
Well, so I think you're asking, in my mind, you're asking about two different
Hmm.
things, and even though it isn't my area, I tell you, I love talking about it, so it's fine. So because you first you said, do we have free will?
Yeah.
So if I separate like the is consciousness free will, because I don't think they're the same thing.
Hmm.
Um, Sam Harris talks about this like constantly and makes the argument. And you can do some great debates from Daniel Dennett and Sam Harris. And I think Sam Harris, and here's a problem. When I tell you what I think, I know a lot of people are going to freak out about it. So I hate
Hmm.
doing that. But when you listen to Sam Harris and a couple, Robert Sapolsky, a couple other really great philosophical thinkers like that, they make a pretty ironclad argument that free will doesn't actually exist. When I listen to their arguments, I think the logic behind it and where they go, and if you really follow it and you're not turned off by it, a lot of people just react automatically when you say maybe there's no free will. They just shut down because it's just so uncomfortable to think about that. But when you're really open and curious and you listen to them, like I come to the conclusion like they're probably right. At the same time, what do I take from that? Like nothing. It doesn't actually change my experience in any way. So it's one of these interesting things that a lot of people get really spun up about. I think it's a fun and interesting discussion, but it doesn't actually change my day-to-day experience and how I like whether I am choosing to eat what I eat for breakfast or I'm not.
Hmm.
It just doesn't change my experience of it. So I don't really get spun up about it.
Yeah. Do you I just want to keep asking philosophical questions now. But I told you I wouldn't, so I'll ask a bonus one, so I'm cheating. But where do you think consciousness goes when people die? Do you think it goes anywhere or just let rest with the body?
I think it goes to exactly where it was, which is it's always been there and always was. And like, yeah, I think um, it was here before what we think of as us, and I think it will still be there. And the fact that I don't know where it came from means I don't know where it's going, but I think it's all the same thing.
Mhm. You ever read Egg? I think by Andy Weir.
No, I may then.
If I'm remembering the it right, this isn't much of a spoiler. It's a short story. You can read it and still get this like really cool thing. Basically, this guy, it's like I'll let you read it. I won't spoil it. I recommend everyone check it out. It's like a 30-page thing. It's really nice. If you like The Martian and stuff, it kind of has like that wittiness to it. And as a father, there's the main POV person is a father technically. So
That's cool.
all right. Yes. So for both the businesses you run or personally, is there anything that we, the listeners, anyone listening in, that you could use help? Like, how could we help you?
Hmm. So I love your question earlier about the research. I don't know what your listeners are like, but yeah, if anyone is doing research in DNA methylation, epigenetics, love to connect. And anyone that just wants to learn more about what we're doing in general, it's TrueDiagnostic.com and wildhealth.com. But yeah, if it's the help, yeah, I think that's it. Like anyone that is potentially interested in that space and is doing research, we would love to collaborate. We're always looking for people to push the field faster and farther.
Sweet. And then the last question, because we're learning with Lowell, I am curious, what are you learning right now? Is there like a thing that you don't know that you're working on, or like what is an aspect that you're actually learning to learn more about?
Yeah, it's the conscious stuff we just talked about, is being aware. That's it. Like it's like being aware of in a meta way of my emotions and my actions and how they all come together. Um, that's what I'm like kind of reading the most about and learning the most about. I just told you about facets of unity, these other things. So that's what I'm exploring the most right now.
Have you ever seen one of those like emotion wheels where they show you like
Yeah,
all the different
yeah.
emotions and what they mean and stuff like that? Uh, I feel like I only feel like four of them, so I'm trying to like be more in touch with my emotions too, because I'm sure the other ones exist. I'm just not sensitive to them. Is that like what you're
I
talking about?
Yeah, the first time I talked to like 15 commitments, they do coaching stuff. First time I talked to when people like I told them like I only have two emotions, period. Like I don't know what you're talking about. And then yeah, it's over time, a long amount of time that I started understanding what these different sensations and things in my body were and stuff. And I've gotten a lot better at it. And I think I took it as like a badge of honor, like I'm like unshakable. I'm just like doing my thing. And then I realized later like I'm just missing out on a lot of richness of life, not being kind of in the
Hmm.
flow of the rising of emotions and kind of coming and going of them.
Yeah, I agree. I think that there's like a lot of subtlety going on. Like I've always had this kind of this feeling like, man, if the world was like Lord of the Rings or like these like fantastical places, the thing is like the world is fantastic. There's a tree outside that's taking light and making it into food, and
It's
then it's gonna
crazy.
feed something else, and I'm gonna eat it. Like that's like
Yeah.
there's like so much crazy stuff going on, and I think that like, emotionally is a similar thing. That there's like so
Yeah.
much more you can experience in life.
If you can tap into that, the wonder, I think that the awe and wonder that we all had like as a child, as a baby, that's amazing. So I love hearing you say that. I think that'd be a great takeaway from me. Like if you could tap into awe and wonder, like your life is going to be an amazing one.
I actually wanted to call my show "The Road to Awe," but my wife
Huh.
said it sounded too religious. Because have you ever seen the movie The Fountain?
No, I haven't
Oh,
seen it.
I recommend it. But it was with Hugh Jackman. I think you'd enjoy it. It's
Okay.
yeah. There's The Fountain, and then there's What Dreams May Come that I think you'll enjoy. Watch it with other
Uh,
people. You might cry, but it's a good cry.
yeah, I'm going to. That's great.
Yeah. I'll leave it on you as last thing to say. But are there movies you'd recommend we check out? We talked about documentaries, but since I referenced the movie, I want to hear your thoughts.
Um, You know, it's funny. I don't watch a lot of movies, but we were just talking about the emotions things.
Hmm.
Recently, I took my kids, I have four kids between like 6 and 14 years old. I took them to see Inside Out
Oh, it's
2.
good. Yeah.
And I was kind of blown away with like the roller coaster of emotions and like how spot on it was, like all the stuff that I'd learned over the last few years
Hmm.
trying to get better at that. And even though it's like a kids movie and a cartoon, I thought it was really profound and good. Like I would, if anybody's not got kids and didn't have an excuse to like just go see it or borrow someone's kids, whatever you need to do, like go see that movie. I thought it was great.
Yeah, apparently in the making of that movie, they brought in teenage girls and had them watch, and then asked them like, is this accurate to how you feel during situation? So like it is like preteen teen girl approved and like how they developed it. So I think that's really interesting in terms of like capturing a different perspective because I've never been a teen girl, so it's like it
Yeah.
is. I think that was really interesting too because I asked my wife, I was like, is this what it's like? And she's like, yeah, this is what it's like. And it's like, oh, that's cool. Like I think because a movie's that movie was great because it did give you an entirely different perspective. Like it
Yeah,
really
for
captured
sure.
it.
Yeah. I
Yeah.
was watching with my 14 and 12-year-old daughters and like it was really cool to I would look over at them sometimes, like thinking like, is it, how much is this resonating with you? So yeah,
And they said it was accurate too.
I didn't ask them, but I just thought it was fun, like being with them as I watched it, like thinking about their experience of the world
Hmm.
and life.
Yeah. Have you ever read the book? Last book. Man's Search for Meaning? It feels like a
Yeah,
book you'd enjoy.
yeah,
Okay,
for
yeah,
sure. Yeah, it's a
yeah.
great book. I've got it in my sauna, like reading it, it's falling apart. It's read it a few times.
All right. Well, Matt, thanks so much for coming on the show today, sharing everybody what's going on at True Diagnostics and Wild Health and or Health Wild. I think it's Wild Health. The second one, right?
Yep,
Yeah,
you got it.
I wrote it down like 4 or 5 times because I kept thinking wild type, the food. It's like don't say wild type. But thanks so much for coming on the show and taking the time to be here today.
It's a ton of fun. Thanks, Lo.